Today we will read about the umbilicus. Umbilicus is the hollow out region in the anteabdominal wall, and the margin is somewhat protruded, and it is supplied by the T10 spinal segment. So it lies in the T10 dermatome, and it is at the level of the L3 L4 vertebral level. Okay, and it is what veg, not non-veg. Veg means it is the meeting point of vascular system, excretory system, and the GIT. Vascular, that here the umbilical artery to umbilical artery, and the one umbilical vein which lies in the umbilical cord, it is attached over there. You can see the umbilicus is the attachment site of the umbilical cord with the fetus, with the fetal body. Umbilical cord is attached at one end with the placenta. So it is the meeting point of vascular, excretory, and the GIT system. The vascular, this is the umbilical artery which is taking deoxygenated blood to the placenta, and we all know that the umbilical cord, it is attached at one end with the placenta and the other end with the umbilicus of the fetus. So the umbilicus, we can say that it is the fetal end of the umbilical cord. And umbilical vein, now it starts from here and going to the liver, and here it forms the ductus venosus in the embryonic age, and afterwards, after birth, it converts into the ligamentum venosum, and this is the medial umbilical ligament. This right and left umbilical artery will remain as the medial umbilical ligament, and the proximal part here, it converts into the superior vesical artery, and the distal part where it is crossing over the from the bladder, now here it is from medial umbilical ligament, and this is the superior vesical artery which is going to supply here the upper part of the urinary bladder. Okay, now about the excretory system, we all know that the this is the lower end of the GIT. Here is the GIT, lower end of the GIT. In the embryonic age, the lower end of the GIT, as well as the mesonephric duct and the paramesonephric duct, which forms the genitourinary system, they all open into a single chamber that is called cloaca, and from that this urachus goes to the umbilicus. Okay, which is a connection in between the urinary bladder. Afterward, it turns into the urinary bladder, the upper part of the cloaca, and which opens into the umbilicus. So this is the urachus. How it is? This is how it is related to the excretory system. Now about the GIT. This is, I have told that this is the lower part of the GIT. So if GIT, we can see that this is a stomach, and this is small intestine, large intestine. It is supplied by the celiac trunk. Here it is supplied by the superior mesenteric, and the lower part is supplied by the inferior mesenteric. This is aorta, inferior mesenteric. This superior mesenteric may supply the middle part of the GIT. Again, it is attached with the umbilical cord through the vitelo-intestinal duct. Okay. Thus, foregut, midgut, and hindgut. Midgut, the arterial supply is by the superior mesenteric artery, and afterwards it is there is vitelo-intestinal duct which connects the umbilicus and the intestinal tract. So this is the link in between the GIT and the umbilicus. Okay, and around which the rotation of the midgut occur. This is the line, that is the vitelo-intestinal duct plus the superior mesenteric artery. Okay, now if these remnants became patent even after birth, what will happen? Suppose this is the urachus which connects the urinary bladder with the umbilicus. it remain patent in the proximal, that is towards the organ side, in the middle part, or this is the distal part, or as a whole if remain patent. Then what will happen? And the second is the GIT. It is connected to even GIT. So if the proximal part will remain patent, if middle part will remain patent, if distal part will remain patent, if whole of this intestinal tract remain patent, then what will happen? First come to the urinary system, and this is GIT. If this proximal part remain patent, this will convert into the urachal diverticula. This condition is known as urachal diverticula. The middle part if remain patent, it will cause urachal cyst. This distal part if remain patent, this is urachal sinus. Rest of this get fibrosed, and only this much is remain patent and opening into the umbilicus, through the umbilicus to the outside, urachal sinus. And if whole of this remain patent, then it is urachal fistula. Urachal fistula. F for fistula, F for free. That is, it is free to pass from here, urinary bladder to the umbilicus. F for free, F for fistula. So don't confuse with the sinus and the fistula, because sinus is a closed tract. Only we can introduce finger up to here only, but here we can freely move. Okay, now coming to the intestinal duct. If it is proximally remain patent only, then this condition is called Meckel's diverticula. Meckel's diverticula. It is present in 2% of the population, and it give, if when become inflamed, it give rise to the symptoms similar to the appendicitis. So, and this is of no use. So when appendectomy, the Meckel diverticulectomy is also done. And if middle part remain patent, this condition is called enterocele, as it is of GIT, the part of the GIT, enterocele. And then when distal part remain patent, this is called raspberry tumor. Raspberry tumor, okay, or cherry red tumor. Cherry red tumor. And if whole of this remain patent, this is the fecal fistula, because through if it remain patent through and through, the urine will come out through the umbilicus, and if it will remain patent, the stool will come out. So this will result into the, if whole of this remain patent, this is fecal fistula. Okay. Now coming to the other clinical significance, ways we can memorize that it is the vascular and the excretory and the GIT meeting point. Ways, wafer. बच्चा लोग को वेफर बहुत पसंद होता है, वेफर्स. Okay. Now what is the clinical significance? W is for water set line. Water set line. The umbilicus is that point on the anti-abdominal wall. It is the meeting point that the lymphatics, the venous drainage, and the arterial supply, all this is up to this mark. It can't go beyond this. And the part which is below the umbilicus, it is going up to this level. So this creates a water cell line, or in another way we can say that line which get dual nerve, venous, and the arterial system, arterial lymphatics, dual system supplies there. It is the last to be get necrosed, because it is supplied by it has got dual arterial supply. Okay. In brain we have also got water cell line where the anterior and the middle cerebral artery meet, and in the splenic flexor where is the superior mesenteric and the inferior mesenteric artery supply. So, and those region, that is the meeting point of those region which is last to get necrosed, but it is first to be affected by DIC, that is disseminated intravascular coagulation, because these are supplied by the end arteries. So that is first to be blocked, because they are very narrow and the first to be blocked. So This is the clinical significance of water settling. Now coming to the E. E is for endometriosis. Endometriosis, when endometriotic tissue is found in the umbilicus, and with the menses time, there will be bleeding occur in that area. It is a rare disorder. Now this is the portal hypertension. Portal hypertension, in which the umbilicus is the site of portocaval anastomosis. From the caval side, it is superficial epigastric artery, which is the branch of the external iliac, which is the branch of the femoral artery in the region of the femoral triangle, superficial epigastric, and it meets with the paraumbilical vein, which is from the portal system. So it is a portal caval anastomosis, and in case of portal hypertension, when there will be portal hypertension due to the backward pressure, the superficial vein over here, it get very prominent and give rise as if one demon that has got hairs, there snakes in place of hair, so it give a resemblance to that medusa head. So that's why it is called the caput medusae, this clinical condition which occurs in the portal hypertension. And this is hernia, that omphalocele. If the protrusion is more than 5 centimeter in length and 0.5, more than half inch in the width, then it is said to be as umbilical hernia or omphal hernia. Okay, umbilical hernia. And when it's normally in the children, it is somewhat protruded, but if more than 5 centimeter in length and 0.5 inch more than diameter, then it is said to be as umbilical hernia. Then E is again the endometriosis. R is for redness, that is the omphalitis. When there is inflammation at that side, that is called the omphalitis. And the surgery, that is the common site for the surgical incision, because for the cosmetic value. And what type of surgery we can do? The gallbladder, laparoscopic cholecystectomy, and the laparoscopic appendectomy. These cases, this surgery we can do from that route. Okay, so this is all about the umbilicus. Thank you.